Today's date is February 13th, 2018. We're here with Eileen and her referring doctor, Aaliyah, who's a chiropractor in Santa Rosa, California, who thought enough of us to bring you here. You are a nurse practitioner, highly educated, strictly allopathic till recently.
Yes.
And you wouldn't have believed anything outside the realm of drugs. Is that correct?
Correct.
That's how you were trained, and I'm not saying this in any way negative. You had some serious problems, and the viewers should know that. You had a plane crash when you were younger, and you fractured your lumbar vertebrae, and it required surgery. And that was a very serious injury, and it altered your spinal alignment. That same plane crash fractured your tib fib on the right side and destroyed your foot on the left side. All that was left was an artery and a flap of skin, and the surgeon actually put it together, and you got good functioning out of that.
Yes.
Which is miraculous, and you've lived a normal life with that.
Right.
But then something happened to you. A couple years ago, you ended up with carpal tunnel syndrome in this wrist, and the orthopedic surgeon operated on it, cut on it, and then within a couple months, you decompensated totally. Is that correct?
That's correct.
You decompensated energy-wise. Your whole system sort of tanked. And in addition, you said that you developed a thickening, a swelling here, which anybody can see, compared to this side. And you've had now 4 or 5 surgeries to pull out inflammatory tissue that's encircling your tendons.
Yes.
And each
correct.
time it gets worse and worse, and every time you do it, it gets worse.
Yes.
They have had you on highly toxic drugs, including the cancer drug methotrexate, which poisons the immune system. And they tried you on Plaquenil, which about burned you up, and you stopped after 2 days, and they've also had you on steroids.
Right.
Correct? And you've been to this nice lady who has sent you over to me, and you were interested in ozone, but the very first thing that I did was I looked at you for energy disturbances we call interference fields.
Yes.
And you knew nothing about this, correct?
Right.
And you're a highly skilled, high-powered health professional.
Yes.
Would you have I found interference fields in a scar in your wrist, which we just injected, in your back, and you also had some female surgery here a few years ago.
Yes.
And we found it there, and all I did was I've injected that with local anesthetic, and in this case here, some ozone as well. What do you notice since we did that?
Since we did that, I've noticed, first of all, my gait is significantly improved. I can just walk easier from my back problems. I notice in general I have a higher energy level. When I was so fatigued all day today, I was just barely dragging around, wanted to lay on the couch. In fact, before I came, I was so tired. Definitely have a higher energy level, and I just feel, I can't describe it, it's just like, I don't know, just energy coming up into my chest throughout my whole body, and I've just felt a sense of well-being, increased level of well-being, I guess I'll describe it as.
Thank you.
Yeah.
That's what I wanted to hear. Now, we're never going to be able to fix the anatomic problems you have, from your injuries, etc. That can't happen. What we're going for right now is to try and restore energy in your body, energy flow, energy dynamics. Your doctors have said that you have an inflammation in here. They don't know why, but they've recently cultured Mycobacterium avium out of that, and they wanted you on drugs for a long time.
Right.
And that just came out of the blue. No one knows where that came from.
Right.
And it could be a lingering problem in there,
Right.
which is another one of the reasons why you're here. So we're going to do a 10-pass ozone on you today. You'll come back and we'll continue to look for new potentially emerging disturbances or figure out other ways to treat this without drugs. Does that sound okay
That
with you?
sounds great.
Okay. I would like to be able to post this on YouTube.
Yes.
I have your permission.
Yes, you
Thank
do.
you. And yours?
Yes.
Thank you very much. Today is February 20th, 2018. We're back with Eileen. She's a week out now. Last week We did scar injections, which gave you considerable relief, did it not?
Mm-hmm. Yes, it did.
And I think your chiropractor told me about 30% overall relief from that.
Right.
And we gave you ozone intravenously,
Yes.
and you told me that that's caused a significant improvement in a scar you have on the back of this arm from surgery.
Yeah, the wound.
It's a wound, not
The
a
wound.
scar, correct? It was open, and even your doctors were surprised at
Yeah.
the
Improvement.
improvement. Okay, so that's to be expected. Overall, you're feeling better, but we
Yes.
got a long ways to go, right?
Yes.
Okay, today I did your sacroiliac joint because you were having pain there,
Right.
and when I did my kinesiology evaluation, it said treat me.
Yes.
So how do you? What happened after I treated it?
The pain's gone.
Totally gone.
Totally gone.
Okay,
Yes.
good. I can't promise you how long that's going to last. It could be local anesthetic time, or it could be
Longer.
indefinite. It
Yes.
could be. So we'll have to see
Okay.
when you come back, and that's all I want to do today.
Okay,
All
great.
right.
Thanks.
Thanks very much.
Yeah.